Hello everyone, welcome to Everything You Need to Know for Clerkship. Okay, so we'll start with an overview of the system. So overall, you have 14 weeks in the whole semester. 7 of them is going to be in medicine, and then 7 weeks in surgery. So we'll start with how medicine works. So it's in total 3 weeks of inpatient wards, and then 3 weeks of in like clinics, so going to clinics, and then 1 week of the emergency department. This is in Al Khor. There might be some differences in Hazm Beirik or Al Wakra. I'm not really sure, but so in the morning, like at least for Al Khor, you start at 7:30, where you go to like the morning report. And in the morning report, it's usually an activity by the resident. So by a resident. So like one day a resident can explain or present a case, like an interesting case, and then another day another resident can present like a research, and kind of like a research appraisal, things like that. Okay, and then if you have an inpatient week, you go to the inpatient ward. They'll show you, like on the orientation week, they show you like where everything is. So in the inpatient ward, it's basically people who got admitted. So if they have like a severe condition, or there's like an exacerbation, like or pneumonia, things like that they need to get admitted for, you're going to see those kinds of patients. So usually in the team, there's a consultant, there's a specialist, and there's some residents, and there's the clinical pharmacist, and then there's obviously you guys, the students, and then sometimes there's a nurse who's like following with the team. So what you do is you stop at the first patient's room. So and then like outside the room, you kind of discuss. So one person presents the case, and you can do this too. You can present the case, and you can basically present. So you can say, this is a 20-year-old man with blah 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 blah. Like you just like present, or like give an overview of what this patient's condition is and why he got admitted and everything. And then so once you do that, then they look at the patient's new labs or any changes or anything. Did anything happen? And then you go into the patient's room, and the doctor can examine the patient, ask them if there's anything new, explain if there's going to be any changes, if this patient is doing well, so they should be discharged. So anything, like things like that. Okay, so the doctor is just going to discuss, and then you go on to the next patient. And usually this takes until like 11:30, like depending on how many patients there are, and depending on the doctor. So if your doctor is like an educational type of doctor, he likes to explain things, he likes to ask, he likes to elaborate on things, then it might take long. But if it's a doctor who just wants to get things done, then you'll finish earlier. So honestly, either way, it's going to work in your favor. If it's a doctor who wants to elaborate, then you're going to learn more. And if it's a doctor who wants to get things done, then you can finish earlier, and then you can go and study, And also, like for us at least, there was our doctor who's like in charge of us. We asked him, is there a study room in the hospital that we can study at? And he found us a room, and he was like, "Khalas, this is the students' room," and we could always go there to study, which was amazing. Okay, so and then so you have 3 weeks of inpatient, and then you have 3 weeks of clinic. By the way, this can alternate. So some people started with clinics first, other people started with inpatient first. For me, it was 2 weeks of inpatient, and then 1 week of emergency, and then another, like my third week of inpatient, and then finally the last 3 weeks were just clinics. Okay, so it changes. It's based on your schedule. But if you don't feel like going to a specific place, and you feel like you study or you learn better in a different location, you can always go. Like it's not as like rigid as I thought it was. If you prefer inpatient, you don't really like emergency, the doctor's not really teaching anything, there's not many patients, you can always just join the inpatients team, yeah. So what do you do in emergency? Yeah, so in emergency, it's gonna be like people just walking in, walking out, walking in, walking out. Usually, a lot of the patients are like workers, and so it really helps to have like a partner or like someone with you who speaks Urdu or like or Hindi or whatever, so that you're with, or and then also like have someone who also speaks Arabic. So like it's good to be in a pair where one person speaks Arabic and the other person speaks like Urdu or Hindi. So when you're together, a language barrier isn't really an issue. So yeah. Uh, yeah, and then in emergency, you can always just, because they're just waiting in the waiting area, you can always just go up to any patient and say, oh hi, like what happened, what, like, do you mind explaining like what happened, why did it happen, blah blah blah. And then you can ask them like, is it okay if I examine and things like that, and they'll be like, yeah, it's completely fine, like it's not an issue. If they're not happy with it, it's fine, you can always go, yani. You don't lose anything by asking. So that's for emergency. The doctors there are pretty chill. You just have to like, yani, involve yourself and don't take anything they say too seriously. Like sometimes, I don't know, emergency doctors, I feel like they have like a weird vibe to them, but like just don't take them seriously. Like whatever, like they're super chill. Okay, doctors in general are super chill, except for some who are strict, but then they actually want to teach you, that's why they're strict. Like either, like there's always going to be advantages to any kind of doctor. Okay, so that's for emergency. And then clinics, yeah. So clinics, you have some in the morning, you have some in the afternoon. And then please, like, remember, like, if there's a clinic that you don't think you're gonna benefit from, don't go. Adi, like, go to any other clinic that you feel like you'll actually benefit from. Like sometimes I would get a random clinic like neurology or something, and I didn't feel like I was learning anything in the neurology clinics because every patient was just on Keppra, and like if they came with an issue, it was because they did not take their medication. Like they would come, they would say, oh, I had a seizure last week. Why did you have the seizure? Oh, because I forgot to take the medication. Okay, so the only issue is the fact that you didn't take the medication. Khalas, stay on medication, nothing's gonna happen, inshallah. I felt like I wasn't learning much in the neurology clinic. So the next time I had the neurology clinic, I would just go to general medicine, or I would go to cardiology, go to the stuff that you feel like is definitely going to come in the exam and you find interesting and you actually learn from. If you hear screaming people in the background, it's just my siblings, don't worry about it. Okay, so where were we? Yeah, so cardiology, the cardiologist in Al Khor Hospital, I don't know if I'm allowed to say his name, but he like gives you a lot of lectures with like ECG and things like that. Go to his clinics because he has like a list of patients that he's saved just for students. And so he will like open an ECG and be like, okay, interpret this. What I did was like I found my own ECGs from the internet and I was like, doctor, what do you think about this ECG? I was like testing him, I don't know why, but like we would like figure it out together, which was so nice. Like I wanted to see what his train of thought was. So like I'd ask him a question like, oh doctor, interpret this ECG, and he'd kind of vocalize his train of thought. So he'd say, the P wave is biphasic, oh the QRS is a bit wide, blah blah blah, and I'd be like, oh okay, so this is how he thinks. And it really helped me. And I don't know why, but like ECGs, cardiology in general, I just love it. So I would go there a lot. So I'd say like go to the stuff that you actually find interesting, even if it's not in your schedule. There is a specific doctor who, like, a lot of people had clinics with him where they would go to his clinic and he'd say, read on asthma. And then he'd leave the office. There would be no patients in that clinic. He would leave the office, do whatever his own things, and then 3 hours later he'd come back and be like, so did you learn about asthma? And the student would be like, yes. And they'd be like, okay, go, khalas, here's your stamp, done. And it was like, what? Like I didn't learn anything. So if you feel like in the first 15 minutes that it's not going to go well and the doctor leaves, you leave too. Don't stay. Like, yani, don't waste your time because, oh, it's written in the schedule and I'm not allowed to deviate from the schedule. No, no, no. Like, literally deviate, but like find the best opportunities to learn. Because if you're just sitting and doing nothing, or if you're actually doing something, you're gonna get tired by the same amount of level or whatever. I don't know how to explain it, but you get me. So like, just find, yani, always like look, like smell opportunities, you know. Okay, so that's for the overview. So 3 weeks of, yeah, okay. And then I'll also talk quickly about surgery as well. So in surgery, it's 2 weeks of ortho, 2 weeks of urology, and 2 weeks of general surgery, and then 1 week of anesthesia. I would say, because my anesthesia week was the very last week. And so throughout the 6 weeks, even though I was in the OT and I'd be seeing what the anesthesia were doing, I was like, no, I can't ask them because I'm not their student at the moment. No, 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 no. Ask. So that by the time you get to the 7 weeks, khalas, you know everything about anesthesia or whatever. Okay? So, and then be opportunistic. Like, if for example, I was in the ortho week and there were no, because it was Ramadan, there were no like ortho cases. There were some days where there was no case in the OT, like no surgery for ortho. So I would just go to general surgery. Like, I would just, find whatever way. And then also in surgery, like in 7 weeks, you're not only always going to be in the OT. Like, there's clinics for each type of surgery. So for general surgery, there's clinics on specific days. There are rounds, like inpatient rounds, so you can go to those rounds. But I would say, like, in surgery, they're not as keen on like teaching in the rounds. They just like very quick, like, oh, look at the wound, is it infected, is the patient having a fever, is CRP going down, like, just they're like on business. They just want to finish very quickly. They're not very interested in teaching. This is at least in the hospital that I went to, which was Asha Hospital. They're not as like keen on teaching. Obviously, there's like specific doctors in each, like in urology, there's a specific doctor who loves teaching. There's a specific ortho doctor who loves teaching. It's like that, So if you don't have that specific doctor, then you're not really going to benefit, but you're going to finish early, and so you'll be able to study. Okay, so that's the overview. And then, oh yeah, so then you have these dumb things called WBAs, work-based assessment, which basically it's like a mini KEX or whatever. It's like, they're basically kind of similar things, but there's this thing called mini KEX where it's like when you examine someone, or when you do, like, you examine a patient or you do something, you ask the patient like, oh, doctor, can you sign this for me? I think there's only like 2, I don't know how many, but like there's like specific things, like there's something called DOPS, and it's also like a similar thing to mini KEX where like you do examination or something, or you participate in a surgery and then you're able to get that signed. And this is for medicine and for surgery. So if you do anything, any examination, or you take history or this or that, or you have a discussion with a doctor, it's called case-based discussion. That's another like set of forms that you need to fill. I think there's like 7 of them, like 7 CBDs, 7 case-based discussions, where you discuss a case with a doctor and you ask them like, hey, can you sign this paper for me, and saying that I discussed this case with you, things like that. So, like, they'll explain all of that stuff in the orientation for you, okay, like in more detail, but I'm just letting you know, like, there are these types of things. Okay, and also you get a mentor. I don't know, it's supervisor, yeah. So you're assigned like a specific supervisor where like you can follow their system, like they'll tell you what their system is. So like for me, my supervisor was, oh my god, amazing. Every week we would have, I think, like 2 meetings. One would be for physical exam, so one of us would volunteer to do like the CVS exam on a patient in on the first week, and then second week it was GI exam, third week was respiratory exam. After that, like, it was like that, you know. And then also we would have a meeting for discussing or like presenting a case that we took history from. So yani throughout, like in that week, we would go to a patient, each one of us, like we were like 3 students for 1 supervisor, so each one of us would take history from a patient, and like we would basically present it to the doctor in that meeting. We would present the case. So, and then he'd say, oh, did you ask about this, did you ask about this? And we'd be like, oh, sorry, I forgot to ask that, I forgot to ask this. And so khalas, like you keep that as a note for the next time. And then yeah, the next time that you take history. And like other supervisors, they had other systems. So one of my friends, their supervisor would expect them to come at like 6:30 in the morning and like do a physical exam and a full history, taking everything for one of the patients. And honestly, like all of the doctors, okay, all of the supervisors, they're so dedicated. So don't worry about that at all. You will learn so much from whoever your supervisor is. Okay, so that's overview. And then the content, what do you do? For medicine, it's CVS, respiratory, and GI. Okay, for surgery, it's the 4 things. So it's anesthesia, general surgery, ortho, and urology. Okay, and now where do you study from? So there's 2, like for the studying part, there's 2 things, 2 main things: Boards and Beyond or OnlineMedEd. If you liked Boards and Beyond in pre-clerkship, then continue with Boards and Beyond. If you did not like Boards and Beyond in pre-clerkship, then go to OnlineMedEd. I'll like link websites and things like that on like where to access these videos. There's also a Telegram kind of thing, so I can also connect, put that in the description. So it's what's it called? Oh my god. So OnlineMedEd, yeah, he's kind of like Dirty Medicine, but he's more concise. Like he won't repeat things. He'll khalas, be on business and like give you the information, you know, which that's what I like. And he goes like he does it on the board, like on a whiteboard, which I really like. Like I really like on OnlineMedEd. Okay, and then so that's one component of it. The second component is UWorld. You need to do UWorld. Like honestly, guys, please, like so for UWorld, for medicine, there is 1,577 questions, something like that, or 1,700. I'm not sure. So questions on UWorld, and then for surgery, there's 702, I think. Okay, so you need to complete these questions within these 14 weeks. Or at least you don't need to do all of the ones in medicine, only the CVS, GI, and respiratory, and maybe blood, because blood is kind of mingled within everything, like every system. You kind of need blood. Like, for example, if it's like a CVS question, or like a GI question, and you see that there is anemia, then there might be some sort of blood loss from somewhere or something like that. Blood is like, it's connected to every system. So I'd say do blood, GI, respiratory, and CVS. Okay, so do those questions. I don't think that adds up to the full 1,500 in medicine, but like you can divide it. I calculated it. You only need to do 20 questions every day. And if like you divide that by 5, that's 4. So with every prayer, you can do 4 questions. So if you do Fajr, you need to tell yourself, like, between Fajr and Dhuhr, I need to only do 4 questions. Between Dhuhr and Asr, I only need to do 4 questions. And if you divide it like that, it's literally nothing. You create a system and then have a partner with you, so like to hold you accountable. Now, where do you access UWorld questions? You have 3 options. 1, you can find someone in year 5, because everyone in year 5 has UWorld accounts. You can find someone in year 5 who has a UWorld account, and you can ask them for their username and password if they're like willing to give it to you. Or you can, there's like a link, like a QU Cloud file where there's PDFs. So you can download the PDF for all the questions with the explanation. It's like basically screenshots of all the questions and their answers. and you can basically just download that PDF and you can take notes on it. You can do all of that kharabit, and like you can highlight or like mark the specific pages or the questions that you got wrong, if you prefer that. And it's also offline, so you can do it anywhere. And then if those two, you don't like those two, there's also a website called medicospira.com. I'll also link that. Basically it's like a rip-off version of UWorld. It works the same way, and it's the same exact questions. The only issue with it is like one account works for like 2 weeks or something like that. I'm not really sure, but like eventually it stops working and then it expects you to pay. It doesn't, it's not the same amount as UWorld, but like it's definitely cheaper. But like why would then, I don't know, you can pay for it, I don't know, but like it doesn't make sense to me really. So then in that case you can just make another account and then use that account again, but then you're not going to have the ones that, like, you're not going to have the undone ones, or like the unanswered versus the answered, blah blah blah, I don't know. So these are just potential options, okay? So how to study. Okay, this is a mistake that I always made in pre-clerkship, and like for a long time, I would start with learning the content. Don't do that. Do the questions first. Make mistakes, because when you do the question, you're like, oh, what? Like, and then you try to understand it. And even if you don't understand it, that's okay. Because eventually when you watch the OnlineMedEd video or the Boards and Beyond video, you'll remember the question. You'll be like, oh yeah, that question that I got wrong. And then that will make it stronger in your brain, But obviously, like, if you use a system that's always worked, do that. But the reason why I say like do questions first is because you can't watch OnlineMedEd while you're waiting in the wards for the consultant to come. Sometimes that happens. Like, yes, you're supposed to start at 8, but sometimes the consultant, like, we don't know where they are. You're waiting for them. And in that time, you can do a UWorld, like 1 or 2 UWorld questions. You can do some, but you can't be watching an OnlineMedEd video like in the middle of the ward. Like, I don't know, but you can do a question, so it's like more efficient. Like sometimes you'll be waiting in the clinic for the doctor to come, or you'll be in the OT and you'll be waiting for the surgery to start because something happened with the patient, and now it's going to take 20 minutes longer for the patient to come in to the OT, or something happened and you don't know what happens. So like, just like in those moments, you can do Anki, you can do UWorld questions. Like, you can always pull something out that you can do quickly, That's what I would say. Like, don't waste the 10 minutes, like 10 minutes of waiting. Use even those, because when you get home, you're gonna be so tired that you'll sleep immediately. That's one thing about the year 4 clerkship. I don't know why, but like, you get so tired. Like, not like, I've done another semester of, like, I did peds and obs gynae in this in this like fall semester, and I wasn't as tired, even though in obs gynae there's so much more stuff that you're doing compared to medicine or surgery. Medicine or surgery in year 4, but I don't know, that just that first semester you're so sleepy, and everyone says that. Like, I thought it was just me, but everyone was like, I don't know why I'm so sleepy. But like, let yourself sleep. It's okay, Annie. So yeah, I would say how to study. Don't waste the 10 minutes here and there, the 15 minutes here and there. Always have Anki around, or always have a UWorld question around. That's why I would say like that PDF idea is not a bad one, because like, it's offline. You can anywhere, you can just like pull it up and khalas, quickly start, or like continue. Okay. What to study. So a lot of people asked, what do you study in the winter break, or what do you do in the winter break? I would say if you're studying anything in the winter break, I would say study blood and endo. Like, I wish like I would have watched the Pathoma videos for blood and endo, because half of the wards and half of the patients that you will see in medicine are going to be diabetes patients. I did not know that diabetes was so common. I don't know, maybe I don't know, but it's such a huge number of the patients in hospital in general are have diabetes, but they come for other issues. But like obviously because um people with diabetes are more likely to have obesity. People with diabetes are more likely to get sick because of the immunosuppression, or immunocompromise thing, like aspect, and then the medication side effects, things like that. There's a lot of issues that come with diabetes. um, so like endo is very important, and then blood, you'll see, like I don't know why, but like when I was in the hospital, like in medicine, I was like, oh my god, I wish I revised blood, because like the labs and just like understanding like, what kind of anemia is this, things like that. Like I feel like blood is just connected to everything, and so if you understand blood, you're more likely to, like, it makes everything else easier. So I would say if you're going to study anything, study endo and blood in the winter break. But more importantly, in the winter break, sleep as much as you can. Eat, like I eat as much as I can. It's like this is like a hibernation period for us, Like this is like a time when you have to reserve. First of all, you have to pay the debt of all the lost hours of sleep in the semester that just passed, and then you have to reserve more sleep hours for the coming semester. So عادي, like sleep as much as possible. And personally, I found that the breaks where I sleep a lot, the semester after I do better. I don't know. I don't know. Maybe there's a lot of confounders in there. I don't know. But like sleep, like actually use this break. Okay. Okay. And then someone asked, is it harder or easier than pre-clerkship? It's not harder or easier. It's just different. Because in pre-clerkship, yes, the content is heavy, is heavier, but you're usually just sitting and studying. Whereas in clerkship, it's more physically difficult. Like you're standing. In the wards, oh my god, my first week of wards, you're just standing for like 3.5 hours or 4 hours. It's different, and you have to learn on your feet. You have to learn in that moment. Like it's not going to be in a book and then you write it down and then you cover, like try to do a question. No, like it's like in that moment you have to learn. But it's like easier, like clerkship is easier, and like because this is the second time or like the third time that you're learning this content. So like CVS, for example, you've already done like a whole unit of CVS. You did CVS in year 1. You did CVS maybe even in high school. So it's like a lot of the information, a lot of the core information is not new, which like that's the good part. Okay, so that's why I wouldn't say it's easier or harder. It's just different. Okay. And then time management. So what do you do? So I think I touched on this like previously, but like if you find any 10 minutes or any 15 minutes, dedicate a specific thing that you will do in those 10 minutes, in those 15 minutes. Like if you like Anki, just open Anki on your phone or your iPad or even your laptop. Like you always have your laptop. So just like dedicate, if you don't like Anki, عادي, a UWorld question, any other type of flashcard, anything that is like quick and easy to do. Okay, and then routine, again, like just do like a little bit at a time. So just tell yourself, okay, I'll just watch one OnlineMedEd video or one Boards and Beyond video today, and I will only do 20 questions of UWorld today, and I'll try to finish the Anki that's in the system. So 20 questions a day four between each prayer, and you're done. You won't even feel like you're studying. So if you do something like a system that is like not too difficult, it'll be more worthwhile. Whereas if you say, oh, I'm going to do 40 question block, when I get home, I'm going to sit down and I'm going to go through every question, untimed, tutored. Obviously, untimed, tutor, random is the best combo for UWorld. Um, um, but like, and then I'm going to go through blah, 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 blah. Like, it's just difficult. It's difficult to digest that, to be able to do that for, like in a long term, every day for 14 weeks is a little bit difficult compared to the dispersed kind of system where you don't waste the 10-15 minutes just standing and waiting. You actually use that time. Okay, how to learn in the hospital. So this is, I guess, the one thing that, like, the main thing that is different. So in the hospital, you have to be able to learn in that moment. Okay, you just saw a patient with COPD exacerbation. What is it that they're doing for this patient? What are they giving this patient? How are they getting them out of the exacerbation? Why did the exacerbation happen? And so this will help you learn. So keep asking yourself questions. Why are they doing this? Why are they doing this? Why are they doing this? And then when you learn a specific thing, like for example, you learned about asthma exacerbation, you and your partner, after the rounds, you can sit together and you can do like a mock history taking kind of thing. So let's say, like, both of you know that the diagnosis is asthma, okay? But one of you will be the SP, like one of you will be the simulated patient, the other one will be the person who's taking history. So in this way, the one who is the SP, because they're the ones answering, so then they have to know what the risk factors are of asthma. So for example, if the patient who's taking the history says, is there anyone in your family who has similar things? The SP student will be like, yeah, actually, but that's because they know that asthma, there is family history in it. So this is like solidifying the information in your head, like, oh yeah, so one of the risk factors is family history, and so I should answer in this specific way. And then on the other hand, the person who is taking the history, they're practicing the system of how to take history, like start with history of present illness, then go on to this, then go on to this, blah 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 blah. So both of you are benefiting, and then for the next patient you can switch, and then because it's going to be a trio, the third person can mark, like the third person can be like, oh, actually you missed review of systems, for example. You forgot to ask this very important question. You forgot to ask, is there anyone in your family who is smoking, or in your house who is smoking? Things like that. You forgot to ask about diet, for example. So in this way, all the three people in this trio are learning, and then obviously you alternate, so you switch for every case. I feel like this was one of the best ways for me to learn. Okay, so, and then how to learn in the hospital. See, these doctors, they're not going to see you again. And even when they see you again, they're not really going to remember you unless you ask a lot of questions. And that's why it works in your favor. So if you say, oh my God, I have this question, but if I ask, they're going to think I'm really dumb. First of all, they appreciate if you ask whatever question, no matter how dumb it is. Second of all, another thing that's different from pre-clerkship and clerkship is that the doctors are very dedicated to your education. Like there was this doctor who, I'll tell you guys a story to show you why not to be scared of doctors and why not to be scared to ask questions and things like that, okay? And to show you how dedicated these doctors are. So I had an endoscopy clinic, it's not really a clinic, but it was like in my schedule, it was endoscopy. So I went to the endoscopy place the night before. I studied like the whole procedure of endoscopy and how it works because I thought that's what the doctors would ask me. So I went, and the doctor was like, okay, so tell me what the indications of endoscopy is. And I was like, upper GI bleeding, blah, 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 blah. And then he was asking me about celiac disease. And I had not studied celiac disease at that point yet. But I just remembered some stuff from year 3, like from iPhone. So he was asking me like, oh, what is the antibody that you test for in celiac disease? And I was like, anti-TTG. And he was like, what is that? Like, you need to spell it out. Like, you cannot give me abbreviations as answers. I was like, oh my God, sorry. But like, I was so shocked. Like, I was so scared in that moment. I didn't know anything. And he was like, oh, like, what is the gold standard to like to diagnose celiac disease? And I was like, I didn't know. Like, I literally, like, everything, it's all, like, I was blank, I was so scared. And, like, and then, khalas, like, endoscopy, khalas, it finished. And then the next day in the schedule, I was in a clinic with that same doctor, and I was so scared. I was like, I tried to study everything related to GI, so that if he asked me a question, I would know. But I was so scared, and like, I was kind of at the point where a lot of students skip, like they just don't go to clinics, and doctors are so busy, they're not gonna chase after you, like they're not gonna look for you. But, and so I was like, if I don't go, no one's gonna find out, nothing's gonna happen. Like, nothing's gonna happen. I already had a stamp for that day from the morning clinic. I did not have to go to the afternoon clinic. But I was like, you know what? Like, I want to show Allah that I'm actually, like, I actually want to learn. And if he sees this like kind of dedication, then he'll like help me, he'll help me be a better doctor, he'll help me get better grades. So I was like, khalas, I'm gonna go. And like, when I was outside the clinic, I was so scared. It's like, ya Allah, I'm only doing this for you, I'm doing this for you. So I went in, and literally this doctor, he was like 180 difference. Like, he was so nice. He involved me in like every patient's case. He would be asking me questions, and I would get a lot of them wrong because I was still scared of him. But like, after the patients finished, by the way, the clinic has to end at 3. So the doctor, like, he can leave at 3. But he stayed until 3:30 to like really take time with the last patient. And then at 3:30, when all the patients finished, he stayed like another 30 minutes or even more, explaining like all of the hepatic disorders and things like that, like anything, like everything that can go wrong in terms of like the hepatobiliary system. And I still have the papers where he drew stuff out for me and explained things for me. I was so shocked because the amount of effort that he put in for one student was so much more than the amount of effort that some lecturers put in for like 80, for like a whole batch. Like a 50-minute lecture that is supposed to be for a whole batch, they're just reading from the slides. And here there's this doctor who's putting in so much effort. He would find cases that would correlate with what he was teaching me to show me. And he would like show me the labs and tell me, okay, interpret this. What is the ALT telling you? What is the AST telling you? What is the ALP telling you? Like, what are these liver enzymes? Yani, the level, the height, the this, that. And then he would show me like, this antibody is positive. What does this tell you? Like, the amount of effort that he put in for just me, like one student, was it was so surprising. It's like, oh my God, like, I had never seen this kind of effort or dedication from anyone else in CMed. I'm so like, I don't like to talk bad about people, but it was just, I was so shocked. And like, honestly throughout my whole like clerkship experience so far, Every time that I said I really don't want to go, like I was so tired that morning, let's say, or like I just really did not want to go to hospital that day, and just say I was sick or something, and I still went. I would learn something that I would not have learned if I had not gone to that thing, like once there was an on call and I was so tired, but I was like, no, khalas, I just need to do it. And I like there was this case who came in, like an emergency case, and I saw this case, and I saw what happened to the patient and what they did for this patient and all of that. And that actually came in the OSCE, like exactly the same case with like the same thing. It literally came in the OSCE. And I was like, oh my God, if I had not gone, if I had just said, oh, khalas, I'm tired, I'm just gonna go home, I would not have experienced all of that with that patient, and I would not know what to say in this OSCE station. And that's why I feel like also having a really good partner is so important, because me and my partner, like sometimes I would I would be so tired, but she would say, no, let's keep going, we can't stop. And then other days, um like like she would be so tired, and I would say, no, we need to keep going, we need to keep going, we need to keep going. And then we would see something that we're like, oh my God, we're so lucky that we encountered this and learned from this. So that's how you learn from the hospital. And some people ask me, like, what is something that you're glad that you did? And one thing I'm glad is that I'm glad that I chose the right partner, and I'm glad that I put my contribution in. I'm glad that I pushed my partner as well. I'm glad that I didn't slack off sometimes for the sake of my partner. Um, so yeah. Uh, and then one thing that I wish I had done more is just think like I'm never gonna see these doctors again. So it's okay, say whatever you want and not worry about what they're gonna think or what they're gonna say. Because sometimes when you ask the dumbest question, actually, like something gets pointed out, or like something is discovered about this patient that could have been missed. And so ask. Like once there was this patient, and like she had placenta previa, so this was an obs-gyn, and basically she had anemia, but no one pointed it out, like no one noticed it. And so I was like, doctor, she has anemia, like should we do anything about it? She's like, oh my God, yeah, she has anemia, like we need to do something. So it's like, ask. Hadi, even if you think it's like a dumb thing, just ask, just talk. Because you're never going to see these people again. Okay, so this is for like how to learn. And then for the final OSCE or MCQ, for the MCQ, it's kind of just like UWorld questions, but it's like way easier. Like the questions are like way shorter and they're way simpler. Like it'll just tell you like what is the most likely risk factor of asthma, whatever. Like it'll just be a one-liner. Like there's going to be so many one-liner questions. I think they might actually change it now that they're trying to introduce more USMLE related, like they're trying to improve um the question quality and stuff like that. But regardless, if you do UWorld, like if you finish all of the CVS, respiratory, and GI in UWorld, you'll be so good. Yeah, and you'll be over prepared, regardless of how hard they make the questions. For OSCE, it's gonna be like again physical exams, the same physical exams of respiratory, of cardio, of GI, but there's gonna be some abnormalities. So in the CVS, they're gonna give you a mannequin, and it's gonna be like one of the murmurs. So for us, it was tricuspid regurgitation, I'm pretty sure. Um, yeah, I think so, or like mitral regurgitation, something like that. But as long as you use the like clinical skills checklists, and you watch the videos for the murmurs, and you watch like OnlineMedEd and stuff like that, you're gonna be completely fine, don't worry about it. And then for us, like for the OSCE, we got an appendicitis, where it's like just a real like SV patient. You do the normal examination, but then they'll tell you, oh, there's pain in the right lower quadrant, and you do the rebound tenderness and all of that, and they're like, oh yeah, it's hurting, like they'll act like it's hurting. And then there's going to be, for us there was one for pancreatitis, so epigastric pain, and when you're doing the exam and stuff like that. And then like when you're done with the exam, like the examination, like the physical examination, the doctor's going to ask you, okay, what is the most likely diagnosis? Pancreatitis. What are the risk factors of pancreatitis? Yani list them out. You list them. What is the management? You list, you like explain the management, stuff like that. Okay, so and then there's gonna be a history taking. So there was history taking for us. It was pulmonary embolism. Yeah. So it was a lady who she came from like a flight, and she is on oral contraceptive medication, and things like that. And she's tachypnic. She has pleuritic chest pain. She has pain in her leg, stuff like that. Okay, and it's not that difficult, but you need to still, like, you need to complete the checklist. You need to ask everything. You know, you get a point for all the everything that you say. And then there's going to be an explanation and planning. There's really good documents for all of these things, like for OSCE, so don't worry about it. I'll link it as well. My very good friend Sarah, she wait, actually I don't know if I'm allowed to say names, but yeah, so she made like a OneNote with all of these notes and everything, so you'll be good. Okay, so that's for the final MCQs and OSCEs. Research opportunities with doctors. Someone asked me about this. So for research, there are specific doctors in every hospital who are very keen on research and things like that. So just find, like, you will see, like, when you get there, when you get to the hospital, you will be able to point out the doctor that is very, like, they like to do research. I could say the doctor for Al Khor, but I don't know if I'm allowed to say names in these kinds of videos. But like, if you're interested in doing research, just like DM me, yani text me on WhatsApp, and I can tell you the name of the doctor who's like interested in these things. Okay, so final words of advice. First of all, sleep a lot. It's okay, it's natural. For the first semester of clerkship, everyone is sleepy. Secondly, learn how to use Cerner from a senior, because the first week, which is like the orientation week, you are going to be given a day where you go to like a specific building in Hamad where there's like someone who like teaches you how to use Cerner. But I don't know why they like teach you how to use, like, as a resident, like it's like how to order medications, things like that. You're not going to be ordering medications for any patient. The most you're going to be doing is like writing a note, like a progress note for like patients who are inpatient, like patients who are in the ward, who are admitted in the ward. If, like, for example, that day nothing new happened or something happened, but it's like, just you need to write like what happened on that day, like just like an entry for that day. Sometimes doctors will say, oh, can you write the note, and then you basically just submit it to your consultant, and then the consultant signs it. Okay, and obviously, like, all of that, eventually you learn how to do it, so don't like stress out in this moment. But I would recommend, yes, obviously go to that workshop because it's mandatory, but learn from a senior. Like, ask one of the seniors that you know in year 5 or year 6, sit with them for like 15 minutes, ask them, where do I see the patients for a specific clinic? So like, if you're gonna have like GI clinic tomorrow with a doctor, and you know that doctor's name, then you can you can search for that doctor's name in a specific place called ambulatory organizer. You go there, and then there's a place where you put the doctor's name, and it's going to show you everything for the, like, all the patients that are going to be there for that clinic. And then the day before, you can quickly review like who are these patients and like what kind of cases are you going to see, so that you can kind of revise those cases, those like topics. And then so that's for the clinic thing. Inpatient, you can ask the residents or like whoever's over, like whoever, like the interns or whoever, to add you to a list, like a special list that is for that team or for the ward. so that you can, like, that list, then it gets like continuously updated. So if a patient gets discharged, like if they're gonna go home, khalas, they're removed from the list automatically. And then anyone who's admitted, they're automatically in that list. So just talk to the residents of your team, or talk to the like interns, whoever. Okay. So that's for Cerner. Like sit with a senior and like figure out how, like how to, in general, like how to access Cerner, all of that stuff. Okay. And then important thing, I, like, when I started a clerkship, I was so scared because I was like, what if I don't know anything, and the doctors are gonna be like, oh my god, like you don't know anything, like why, like how are you like, I don't know, like I was just scared of doctors. Okay. But then I changed that kind of mindset by changing my intention. I was like, okay, why am I doing this? To learn and to please Allah. So before I went into the hospital every morning, I would stop and just for a second before going in, I would say, Ya Allah, I'm doing this for you. And Ya Allah, yani, help me gain as much knowledge as possible today. And so I like made it about myself. So even if I looked stupid, even if I didn't know answers, it was okay because I'm learning, and that's the reason why I'm here. I'm not here to impress anyone. I'm not here to make friends. I'm not here to like show off all the knowledge that I have or anything like that, you know? So always have like like your intention, and you renew your intention before like every day. Okay? And then another thing that I noticed that like became a problem, I didn't realize it would be a problem, was in the on calls, because sometimes things get very hectic and like multiple patients will come in at the same time, and it's just going to be like very hectic, and oh my god, do this, do that, go with the doctor here, go with the doctor there. One patient needs to go into urgent surgery, like it's just it becomes very hectic. And so sometimes you might forget to pray, especially in the winter where like a lot of the prayers are like very, very close together. So like Asr, and before you know it, it's Maghrib, before you know it, it's Isha. So like just having yani, that in mind, like consciously having it in mind, or like reminding your partner, you know, reminding each other like, okay, even though everything is hectic, we need to monitor, like we need to keep watch of the prayers and make sure that like we don't miss any of the prayers, especially in the hospitals that don't have windows, or like the wards that don't have windows. It's difficult to, like, you don't notice the sun setting, and so you think it's still asr, and you're busy with like the three patients who got admitted at the same time, and before you know it's like maghrib, and you're like, oh my god, I missed asr. It's just, you know, something to keep in mind. But yeah, other than that, I don't have anything. Obviously, like, keep in contact with your favorite senior, ask them questions, they won't get annoyed. I was always scared to ask seniors for help because I was scared of what they would say, or oh, they would like, I might annoy them, blah blah blah. But no, that's not the case at all. Adi, if they're getting annoyed, they just won't respond. And okay, what will happen if they don't respond? You're not gonna die, you know. Khalas, you'll realize, oh, this person doesn't like me texting them. Go text another senior, Adi. And like, if you have my number, like, you know me, Adi, anytime you can text me, and it's not a problem at all. But yeah, I wish you the best of luck. And yeah, goodbye.